13-year-old Divine Atim, a resident of Entebbe, was diagnosed with diabetes at the shocking age of 1 year and 5 months. According to her mother, Martha Asio, she thought that her daughter had contracted malaria, only to later find out from doctors that the daughter was suffering from diabetes.
She was falling sick. We went to the main hospital in Lira. We were given treatment for malaria. Then after the treatment for malaria, she wasn't getting any better. She was just getting worse.
Childhood diabetes, also known as type 1 diabetes, occurs when the pancreas does not produce enough insulin, a hormone that regulates blood sugar.
I really broke down when I had that. I broke down with it was something strange. I was like, God, how can this be? How can my child suffer from a strange disease like this? What happened? So many questions come into your mind. I was like, God, what have I done?
It is estimated that 1.1 million children and adolescents are living with type 1 diabetes around the world. According to Dr. Terry Piloya, a pediatrician at Mulago Hospital, a diabetic child will present several symptoms like weight loss, drinking water frequently, and others, as she explains.
The child is always hungry. They eat, but they are not gaining weight. If nothing is done, the child, many people will go and they will tell them, maybe she has a urinary infection because they are passing a lot of urine, they're ever passing urine.
Diabetes is most times disguised as other infections. Children are brought in the hospital when it's late. This is why the doctor encourages parents to visit hospitals for a clear diagnosis through blood and urine tests.
When your child goes to the hospital, they would just take off little blood from the finger poke and use a meter and use a machine called the glucose meter to test. And that meter can give us a clue whether your sugar is high or not. The urine test is you check the urinalysis. And in that, we are looking for sugar in urine.
Diabetes requires a lifetime treatment, and because it is the lack of insulin that breaks down the food, Dr. Piloya refers to the patients as brave girls and boys since they get insulin injections for a period of time.
So they may have to inject themselves with the medicine about 3 to 4 times a day, but then they may have to poke themselves about 6 times a day. Not only do they give the injections, they have to monitor their blood sugar.
Over 132,000 children and adolescents are diagnosed with type 1 diabetes each year. According to medical experts, type 1 of diabetes is not preventable.
The type that the children get, the children have done nothing for it to come. However healthy they may have been, some of them are very skinny, small children, and then they get diabetes. So for the childhood diabetes, it may not be easily preventable.
In 2009, a program funded by the World Diabetes Foundation led to a research in 22 health facilities in Uganda, and since then to date, over 2,000 children with diabetes have been registered. Health experts recommend that children with diabetes should maintain a healthy diet by eating local foods and balance the amount of food with insulin injections and limit on refined foods as much as possible so that sugar levels are regulated.
Diabetes has no cure. And according to doctors, they still can't point a finger on what exactly causes childhood diabetes, meaning when a child gets it, it's a lifetime illness. Therefore, the task goes back to you, parent or guardian, to ensure that you be keen on your child's health and notice the signs and symptoms the doctor just explained, so that you take your child to the hospital and you start early treatment so that you prevent future or further complications. Sharon Twebaze, CTV, PM Edition.